Ugo Nwokoro.
You got it.
I got it. Nwokoro.
Okay.
So Ugo owns, his family owns a hospital in Lagos. Be careful, don't fall in the water. Alright. Owns a hospital in Lagos, a private hospital. So we're here to talk about, in terms of investment, what kind of investment can be done in this company. And they also have a software that is specifically for the healthcare industry. So we're going to talk about that as well, on how we can pull in investments from the diaspora also. So in a nutshell, what does your hospital does? What is how can the diaspora come in and invest in your company?
Okay.
First of all, in the hospital business, and then we're going to cover the
software.
software business as well.
Yeah. Firstly, what I really do as a person is that I'm quite passionate about healthcare in Nigeria, improving the quality and standard of healthcare.
Yeah.
Because having lived in the UK and visited many other countries, what we find that is the kind of healthcare you get access to there is so much better.
Right.
Here we're still struggling treating simple illnesses and just general coordination. It's not that doctors aren't good, doctors are quite good. That's why I've talked doctors are being shipped to all the other parts of the world. It's the standard of the organization of the medical practice.
Okay.
So
and the equipment there to do their job?
Equipment's available, but it's expensive.
Right.
So the hospitals that can get this equipment have to charge very high to cover the cost of the equipment.
Right. Okay.
So the equipment is only available to a certain class of people.
Okay.
So just general, coordination of hospitals is what we're looking for. So both businesses I'm involved in are trying to achieve this goal.
Right.
The hospital are trying to reach international standards.
Yeah.
And for the healthcare, for the software company, we're trying to help as many hospitals as possible to become digital, so that they can, improve their efficiency a lot better. Yeah.
Because as you said, a lot of the things are still paper-based.
Yes, exactly.
Okay. And in terms of affordability, because we know that a lot of our people go abroad to do, their medical interventions.
Yes.
What if you say that in terms of the private sector, the quality is there, the care is there, so why are people still going abroad to
access healthcare?
Yeah, is it because it's a trust thing? You don't think
I'll say it's a case of trust. Maybe the Nigerian people that leave the country to access healthcare don't believe that they can get the right kind of care here. Exactly.
Okay.
Which is
an issue.
It's
an issue.
It's a massive issue. And there are a lot of infrastructural challenges that do actually face the hospitals here.
Yeah.
Besides it being very expensive to reach a good standard, electricity isn't very consistent.
Right.
So it's hard to give the kind of care that people deserve. Really.
Okay. So in your hospital, for example, can someone from the diaspora who's got loads of spare cash, can they just come and then be partner with you? Is it possible for them to, if they come with their money, what are you prepared to give in return?
Yes.
What sort of investment?
So we're constantly open to investment. I think the hospital is going to an investment round coming soon. So what we're looking for is the money to fund a lot of the improvements we're trying to make.
The equipment.
Buying equipment is a major thing, yes. Improving standards all over as well, like aesthetic and infrastructural changes to the facility. So for example, what the hospital is trying to do, one of our short-term goals now is to get what we call COSASA accreditation. Okay. COSASA is just an international accrediting body that gives you a certificate saying your hospital reaches this standard. Exactly, that's it.
Okay.
So they are internationally recognized. COSASA is for like the sub-Saharan Africa region. And once you have access, have their certification, it opens you to a wider array of customers. Yes. Because they will submit your name to embassies, international embassies. So people coming from outside the country can access healthcare facility. It means you are able to match what's going on out there. Exactly. So getting that accreditation costs a lot of money, because they want to make sure that your hospital infrastructurally meets all the standards. One simple example is they want us to to make sure that there's a direct path from the entrance of the facility to the emergency entrance and out. That is something that means we need to knock down walls, open certain spaces, widen corridors, things like that. You know, those are international standards.
Okay, alright. So in terms of how big is your hospital? How many staff do you have? How many doctors do you currently have? Nurses in total? What is how big is your hospital?
Quite big when you look at if you're counting number of staff.
Yeah.
We have about 260 people as at last count.
Okay.
About doctors, I'll say about 35. Nurses between 50 and 60.
Okay. Okay, so it's quite a big organization.
Yes, quite busy as well.
Quite busy, wow. Okay. And it is based in mainland Lagos.
Surulere.
Okay. So what is the name of your hospital?
Havana Specialist Hospital.
Havana Specialist Hospital. Is that a website, really?
Yes. Yeah. HavanaSpecialistHospital.com. Yeah.
Brilliant. Okay, cool, fantastic. So moving away from the hospital business, I know that you have a second, side.
Yes.
Which is also in the industry of the healthcare, which is the software to improve the hospital management, you say. Okay. So what is the software, and how can a diaspora come in and get involved?
So I'll explain it in simple layman terms. When you go to a hospital in Nigeria right now, when you get to the entrance, they'll ask you what's your file number. You say 551 or something. Then they go into the back to a heap of files and start sipping through files to find yours, which sometimes takes 30 minutes, 1 hour, however long it takes. Yeah. They get out your file, and then the doctor has to flip through pages and pages, write whatever goes on in there, and hand it off from department to department to take that you go to the hospital. So this process is incredibly slow, as you can imagine.
Yep.
It means that your healthcare record is only accessible to whoever is on site. So it can't be remotely accessed. The data for the hospital itself to even gather data about patient visits is very difficult. They can't. To be able to say, 10 patients visited today, 20 visits tomorrow, last month 100 visited, to have data to actually manage the facility and know what's going on, it's very hard to collate because everything is on paper. But what we're trying to do is to digitize that process completely, so that when you go to a hospital, just like in the UK, all you have to tell them is your name, or your date of birth, or your NHS number, whatever. Yes, you type your name on the system and everything comes up. Okay? The doctor can consult on the system directly. If the doctor prescribes any drugs, the pharmacy will see it at the pharmacy. No need to carry it between the two locations. And then it gives the hospital a lot of feedback. So this is where the value for the hospital is. Meaning it can tell them what's the most recurring disease in the hospital right now. What drug is selling the most? Which doctor is consulting the most patients? It can give them data, their finances, medical reports, everything can be done.
And your team have written the code on this software and built something.
Okay. And it's built specifically for hospitals in Nigeria.
In Nigeria, okay. So in terms of, for example, if someone who has experience in sales can just come into your team, someone from abroad, for example, join your team and build a sales team to take the product not only outside Lagos, but also to the northern, outside Nigeria, cover the African
as well.
Okay,
so that's what we're looking for, I think.
Okay.
And in terms of investment, we're not just looking for money, we're really looking for expertise as well. Anyone who has skilled expertise. So anyone who has experience in technology, scaling technology, or building a sales distribution network, those kind of things, as well as the cash.
Okay, fantastic. Because a lot of people that I interact with in the diaspora, they say, well, they don't know what to do. They're going to come to Africa and be looking for a job. I say, no. When you come to Africa, when you come to Nigeria, whatever skills you've got, you can start your business. And so some people say, well, I'm a cleaner, or I'm a this. I say, well, you can come and build a cleaning business and start, because a lot of houses, actually, a lot of families here need, the services of helpers. And it is a thing in Nigeria that a fairly middle class to upper class families do have several helpers to come and help, which we don't really have that luxury abroad. But in Nigeria, it is actually part of
It's about
It's about
culture,
culture,
really,
yeah, absolutely. So someone who is interested in sales, who wants to build a sales team, is actually a nice, great product for them to work on.
Yes.
Fantastic, okay.
And we're quite passionate about, like I said at the beginning, about healthcare. How can we get as many hospitals in Nigeria to delivering a level of healthcare at a quality that matches the UK or the US or India, so that we can reduce medical tourism.
Absolutely.
So what we find is all our clients doing better business within 6 months of installing our software. Yeah, that's what we find. So if we can get this product to as many hospitals as possible, that's where we want to go.
Okay, fantastic. So can you remind us what is the website for the
software?
For the software company?
So the software company is called Swift Medispark. That's Swift, S-W-I-F-T. Medispark is M-E-D-I-S-P-A-R-K.
Okay.
Medispark.
So I just googled it and the website came out first. Yes,
exactly.
yes.
Yeah, so that's swiftmedispark.com, Instagram at swiftmedispark, Twitter at swiftmedispark.
Fantastic. So for anyone out there in the UK, in America, if you're interested, please get in touch with Ugo directly, or just send us an email to business@globalafricaninvestorsalliance.com, and we will just link you guys up. Okay?
Awesome.
All right then. Thank you very much, Ugo,
Thank you
for your
very
time.
much.
Okay. See you soon. Okay.